Our COVID-19 talks continue today with Dr. Amanda Novack from Baptist Health joining us live. Dr. Novack, thank you again for joining us today. Happy Friday to you. And let's begin with what we talked about earlier in the newscast. Merck announcing that they have a new COVID pill that could reduce hospitalizations and death by half for some patients. What do we know about this drug?
Right. So molnupiravir is the name of it, and it is kind of a general antiviral. So it's not specifically targeting the COVID virus, but it targets viruses like COVID. And so it's been studied on flu and a couple other things, but it's been shown to be pretty effective at preventing people who are at risk of severe disease from going on to be hospitalized or dying of COVID. So the biggest news about it really is that it's a pill. And so we don't have to bring people into the hospital or an infusion center, that we can give out prescriptions and treat people at home. And so the simplicity of that is what's really encouraging. What's a little bit, not as encouraging is this is nowhere near as effective as at preventing hospitalizations as the vaccine is. So still about 7% of people that got this pill still had to go on to be hospitalized. And so it's not a perfect treatment option, but at this point, we just want all the tools that we can get, and this is one more in our toolkit.
Oh, that's good news. Let's talk about the booster. A lot of people are getting their booster. They may be going this weekend. A big question that we haven't heard much about is after the first dose, especially the second dose for the Pfizer or Moderna shot, you saw people that maybe had to take a day off work because they were experiencing symptoms for that day. Can you expect that with the booster shot?
Right. That's a good question. And so I kind of have two answers. The sort of official science answer is that the third dose seems to be about like the second dose as far as the severity of side effects. In my personal experience, I feel like people are somewhere in between the first and second dose. People that had really severe reactions to the second dose tend to not necessarily have such fever and body aches and that sort of thing with the third dose. So I think the concern was that the first dose was a little achy, the second dose was really achy, and that the third dose would be extra painful. But it's really, that has not proven to be the case in my experience or what anyone else is saying around the country. Some mild symptoms, some kind of flu-like symptoms for 12 or 24 hours, and then they tend to resolve on their own.
Good advice, kind of like getting your flu shot. Earlier in the newscast, we continue to report every day hospitalizations continue to decrease. Certainly good news. Are you seeing relief at the hospital right now?
So yes, I mean, there's no question that things are less tense, that we have more ICU beds available, and that the ER is not quite as busy. It's still a high volume time. I mean, the hospitals are still busy, but not nearly like we were a few weeks ago. I think what's concerning is kind of this more long-term burnout. So even though there is definitely relief in the day-to-day operations right now, there's just a general sense of fatigue among our healthcare workers. And so still support your friends that are healthcare workers and reach out. It's going to take a long time for healthcare workers to recover from what we've been through the last many months.
True heroes on the front line. We appreciate you all. Dr. Amanda Novack, thank you so much. We love having you on, and we hope you have a great weekend.